Constipation. We've all been there, feeling bloated, uncomfortable, and maybe even a little cranky. But don't worry, we're about to give you the lowdown on how to beat it. From lifestyle changes to the medications that can help, we'll cover it all. Let's get started. What is constipation? Constipation happens when bowel movements become less frequent, difficult, or incomplete. Usually, people define it as having fewer than 3 bowel movements per week. The stool may also become hard, dry, and painful to pass. Constipation can be either acute or chronic. Acute constipation is short-term, often caused by a change in diet, stress, or dehydration. It usually resolves with a few simple adjustments, such as hydration and consuming more dietary fiber. Chronic constipation, however, lasts for 3 months or more and might require ongoing treatment and a deeper look into underlying health conditions. There are times when constipation could be a warning sign of something more serious. Red flags include blood in your stool, significant weight loss, severe pain, or constipation that's suddenly very different from usual. If you notice any of these, it's time to consult your doctor. Don't ignore the signs. The key to preventing constipation often lies in lifestyle changes. Drinking plenty of water, increasing fiber intake, and staying active can make a big difference. Fiber helps bulk up the stool and keeps things moving, while exercise helps stimulate the digestive system. And don't forget regular bathroom routines to avoid holding it in. There are different kinds of mediations you can use to treat the problem, some of which require prescription, but most of them don't. 1. Fiber supplements. For mild constipation, fiber supplements like psyllium can be really helpful. They work by absorbing water to form a soft, bulky stool. Side effects? Bloating and gas. So start slow. They are sold over the counter, and sometimes you can buy them even at your local grocery store. 2. Stool softeners, like docusate sodium, work by helping water penetrate the stool, making it easier to pass. It's gentle, but be aware it might take a day or two to kick in. 3. Laxatives. The laxatives are divided into 2 different groups. First, stimulant laxatives. Stimulant laxatives like Vici or Senna work by stimulating the muscles of the colon, promoting contractions that push stool through the intestines. They work quickly, usually within 6 to 12 hours, but overuse can lead to dependency, meaning your bowels might not function normally without them. Side effects include cramping, bloating, and diarrhea. They're best used for short-term relief. In the US, they are sold over the counter. Second, osmotic laxatives. Osmotic laxatives, like polyethylene glycol or lactulose, work by drawing water into the intestines, softening the stool, and making it easier to pass. They are generally gentler and less likely to cause dependence compared to stimulant laxatives. However, they can cause bloating, gas, and diarrhea, especially if the dose is too high. They may take a bit longer to work, typically 1 to 3 days, but are safer for longer-term use. They are also sold as an over-the-counter medication. 4. When lifestyle changes and oral medications aren't enough, or you have a case of acute constipation, local treatments like enemas and suppositories can be effective in providing relief from constipation, especially for short-term use. Enemas are liquid solutions that are introduced into the rectum through the anus. They work by softening stool and stimulating bowel movements, providing quick relief. While enemas are effective for immediate relief, they should not be used frequently, as overuse can lead to dependency and disrupt the body's natural ability to have regular bowel movements. Suppositories, on the other hand, are solid medications that are inserted into the rectum, where they dissolve and stimulate the bowel. The 2 most common types are glycerin suppositories and Vici suppositories. Suppositories act quickly and are often used when a bowel movement is urgently needed. However, like enemas, they should only be used occasionally to avoid disrupting normal bowel function. Both suppositories and enemas do not require a prescription. 5. Prescription medications. If over-the-counter options aren't enough, your doctor may prescribe something stronger. Medications like linaclotide or lubiprostone can help by increasing fluid in the intestines or enhancing motility. These drugs can be effective, but may come with side effects like bloating, diarrhea, or abdominal discomfort. So there you have it. Whether it's simple lifestyle changes or medications, constipation doesn't have to control your life. However, if symptoms persist, or if you experience any concerning signs, it's crucial to consult a healthcare provider. Your health is important, and seeking professional advice can help prevent further complications. Feel free to comment, ask questions, or share suggestions for future videos in the comment section below. I'll do my best to answer them promptly. If you liked the video, don't forget to hit the thumbs up button. It really helps my channel grow. See you in my next video.